Congratulations on the purchase of your F5000III inversion table. This tape is designed to provide you with the information you will need to get the most benefit from your inversion experience. Your program of inversion will reduce stress, improve circulation, ease lower back pain, and reduce compression fatigue. As with any program of stretching or exercise, there are some contraindications to keep in mind. If you have any of the following conditions, you should see a doctor before trying inversion. A number of these conditions are commonly treated by inversion, but this must be done only under strict medical supervision. This list is only a guide. If you have any questions, please consult your doctor.
Since 1982, I've used inversion therapy with my chiropractic patients. I find it to be a very safe and effective way to help treat many spinal conditions. Patients suffering from conditions such as scoliosis and disc ruptures heal a lot faster and stay healed for a lot longer when they're using regular inversion therapy. 7 inches of our spinal height is disc space. And when patients hang upside down, it pulls the discs apart and it gives them a chance to refill full of fluids. And this helps the patients feel better and helps prevent spinal pain.
To begin with, you should have a box containing all the parts, assembly instructions, and a laminated user's manual that's attached to the A-frame. This manual should stay on the frame at all times to provide a convenient reference anytime you need it. You should also have a newly updated edition of Better Back, Better Body by Joanne Broach. This book will explain many of the concepts touched on in this video and provide you with additional medical information. The book is free with your table, so if you haven't received one, contact your retailer. Let's talk about the setup of your F5000III inversion table. There is a detailed set of assembly instructions included with the unit, so we won't go into them on this video. There are a few things to remember as you set up your table. Make sure that you have all the parts listed in the assembly instructions. Be sure to put the table together exactly as shown, with no deviations. And test the table thoroughly before using. Your table should look like this when completed. It should swing freely, and the A-frame should be setting fully and evenly on the floor. Before you mount the inversion unit for the first time, you'll want to select the proper roller setting. The 3 holes on the roller hinges control the speed and angle of inversion. The hole closest to the roller wheel allows the table to tilt back quickly and lock in the inverted position. The middle hole will tilt the table at a moderate speed and will not lock. We recommend you use the 3rd hole, the one furthest from the roller hinge, as you get used to inversion. This will allow you to invert slowly and have the greatest control over the angle of tilt. Inversion should be worked up to over time. Note, many people never fully invert and still receive all the gains of inversion. As an additional safety feature, you will want to attach the tether strap to stop rotation. If you are a first-time user, set the strap so the table will rotate to approximately 25 degrees. Next, select the height setting. While pulling out the height selector pin, adjust the main shaft until the last number setting is 1 inch more than your height. For instance, if you are 5 feet 10 inches or 178 centimeters tall, you would adjust until the last number you can read is 5 feet 11 inches or 180 centimeters. Remember, these numbers are only to be used as a starting point. Depending on your individual weight distribution, your best setting may be 1 to 2 inches on either side of your actual height. Now it's time to step onto the table. When using the table for the first time, it is important to have a second person present to help you control your speed. Now, pull out the locking pin and withdraw the front ankle clamps enough to comfortably insert your feet. Stand on the foot platform and, pulling out the locking pin again, allow the ankle clamps to close tightly around your ankles. Make sure the locking pin has engaged a hole, or you could fall when the table inverts. As a first-time user, you must make sure that you have the correct height setting. With your ankles clamped firmly, lie back with your hands at your sides. The F5000III works just like a teeter-totter, responding to very small changes in weight distribution. Place your hands across your chest. You should begin to tilt back, with your feet remaining lower than your head. If your head is lower than your feet, dismount and lengthen the height setting by 1 hole and test again. If your feet don't move at all, shorten the height setting by 1 hole and test again. This is an important step, so feel free to spend some time on it. Now that you're properly balanced, it's time to invert. Remember to take it slow and easy, and stop immediately if you feel dizzy or nauseous. Lying flat on the table with your head back, raise one arm slowly up and over your head. You should begin to tilt back. If you feel you're going too fast or too far, you can stop the movement by stopping your arm or moving it back toward your chest. When you raise both arms, the speed and rotation of the table will increase. When you reach a comfortable position, rest your arms where they are and you will stay in that position. When you wish to return to an upright position, bring your arms to your sides. You may find that while relaxing at an inversion of 45 degrees or more, your body will stretch 1.5 to 2 inches, and thus will not return to a full upright position when you move your arms forward. In this case, simply bend your knees without sitting up and pull your body forward. This will transfer more weight to the foot side of the table, and the teeter-totter effect will tilt your body up. Note, as you reduce the angle of incline, you may find yourself getting dizzy or nauseous. This is caused by the inner ear adjusting to unaccustomed movement, as well as increased circulation of blood throughout the body. These symptoms will usually go away after a week or so of consistent use. If the symptoms stay or get worse, you should consult a doctor. One way to lessen the symptoms is to stop at several different places on your way upright. This will help your body get used to the renewed effect of gravity compression. When you are fully upright, rest for a moment before standing. Now that you've inverted for the first time, let's talk a little more in depth about how to progress in the use of your F5000III inversion table. Invert and come up slowly. Start out at approximately 20 to 25 degrees of inversion. This will minimize the disorientation as your body gets used to the new angles. Only invert as long as you are comfortable. This could be as little as a few seconds. Stay at approximately 20 to 25 degrees until you are completely comfortable, and then change the angle by only a few degrees at a time. Don't feel that you have to invert completely. Most people find that 25 to 60 degrees of inversion is completely adequate. Numerous studies have shown increased benefits when the subjects incorporated movement with their inversion program. This will also allow you to hang for a longer period of time. Partial inversion without movement should be limited to 1 or 2 minutes. Full inversion without movement should be limited to a few seconds. You can add movement in 3 ways: intermittent traction, rhythmic traction, and stretching. Doctors often recommend intermittent or rhythmic traction because the alternate stretching and compressing of the spine creates a pumping action, which brings fluids into and out of the spinal area. In this way, valuable nutrients are brought in and waste is removed. This is important because the discs are totally dependent on surrounding body fluids for healing, as they do not have their own blood supply past childhood. Intermittent traction is a program of 1 to 2 minutes down and 30 seconds up. When using rhythmic traction, you are rocking constantly, with little or no stopping between movements. Some stretches can be done either partially inverted or fully inverted. However, many of the more advanced stretches can only be done while fully inverted. You should attempt these only after you have become completely comfortable with full inversion. Side bends, side-to-side rotation, and back arches are popular. You can also do a couple of sit-ups or an inverted squat. The primary purpose of inverted stretching is to encourage blood, lymph, and spinal fluid circulation and aid in the alignment of your bones and organs. Vigorous exercise is not recommended. When stretching while fully inverted on the F5000III, it is recommended that you use the optional boot bar that allows you to wear our Hangups gravity boots. You will find total inversion much more comfortable with the added support and comfort of these boots. Listen to what your body is telling you. You are unique, and your pacing while inverting will be unique also. Some people will stay at 20 degrees inversion forever, and some will be fully inverting in a few weeks. It all depends on your individual needs. You will probably find that 2 or 3 regularly spaced sessions a day will provide you with the most benefit.
A few minutes a day, twice a day of stretching and range of motion can really help with many different spinal conditions. First, start with lateral flexion. Move your head to the side and then move your shoulders down and then move your low back and just curl up to the side. Do that to each side. Then bend your head forward and then bring your shoulders up and then curl your low back up a little ways. Then go backwards. Flex your head back, then your shoulders, then your low back. And then rotation. Turn your head as far as you can to one side. Then turn your shoulders to that side and then your low back. And reverse it in the other direction.
We hope this tape will assist you in receiving the full enjoyment of your new F5000III inversion table. If you have any questions about the information contained in this video, contact your local retailer or call us directly at area code 206-473-6870.